Yeah, now we are live.
Good evening, everyone. I'm Dr. Maunika, Medical Advisor from Shield Healthcare. I welcome you all for today's session. And before starting the session, I would like to give a brief introduction regarding Shield Connect. Shield Connect is basically a knowledge sharing platform which is related to gynae and gynae and pediatrics, which is a knowledge sharing platform for many doctors have even shared their blogs here, and there are a lot of special patient awareness programs and newsletters and various information regarding gynae and pediatric nutrition has been there. So I would like to introduce our speaker, Dr. Sangeeta ma'am. She is MS OBG, credentialated menopause practitioner. She's a senior consultant from Lucknow Gynecology and Gastroenterology Center, fellowship in cosmetic gynecology, American Board of Cosmetic Gynecology, Joint Secretary, Lucknow Menopause Society. And I welcome Dr. Poonam Mishra ma'am, coordinator, MBBS DNB. She's a director of Manas Hospital, Manas Gynae and Cosmetology, Laser Center and Miracle Aesthetic Clinic, Lucknow. She's a president of Indian School of Aesthetic Gynecology and chairperson Cosmetic Gynecology, IASRAM SIG, member of Sexual Health Committee, FOXY, ISMPMM. So I welcome you, ma'am, for today's session. I hand over the session to you, ma'am.
Thank you. Thank you so much, Dr. Monica. And I'm extending a warm welcome to everyone. Am I visible? Actually, I'm gone.
Yes, ma'am, you are visible.
Okay, so how can I am not viewing myself? I'm not able to view myself. Okay, now, yes. So a warm welcome to everyone joining this session of Indian School of Aesthetic Gynecology, along with the platform is being provided by Shield Connect. And every month we are organizing an awareness sort of program. This is actually for creating awareness regarding cosmetic gynecology, which is still something very much hyped and which is still something unreachable for our fellow doctors. Many doctors are keen to learn so many things, and many programs, diploma courses, master's courses are running, and many are like co-gynecologists are there who are willing to know the basics of cosmetic gynecology. And that is why this Indian School of Aesthetic Gynecology has started a program, Cosmetic Gynae Made Easy. And I'm really thankful to Shield Connect for providing this platform every month to us. And we are reaching many of our friends. And yes, I'm getting very good feedbacks also from our friends that they are actually learning something basics. Many of our friends are knowing too much about this field because everyone is keen to learn and everyone is learning also every time through the workshops, through the conferences, and many more available platforms. Yet we are willing to provide many lectures as well as awareness programs for public health also. So this is something a bit of contribution. And without wasting much of your precious time, I am inviting our senior guest gynecologist, Dr. Sangeeta Mehrotra, ma'am. And we are actually obliged to have you here, ma'am, because yes, today's lecture is very special: PRP and regenerative medicine and cosmetic gynecology, the stem cell therapy, and many more things she is going to enlighten. And this is something very special and very futuristic. You know, the treatment is now moving towards the regenerative medicine in every fraternity. So cos gynae or gynae obs, infertility, everything, everywhere this is being utilized. So let's invite Dr. Sangeeta Mehrotra, ma'am. Please, ma'am, the dais is yours. The platform is yours. Now it's your turn.
So thank you so much, Dr. Poonam, for inviting me to this very special platform which you have started, the e-learning platform for the cosmetic gynecologist, not only for the cosmetic gynecologist, but every gynecologist who is passionate about the cosmetic gynecology. And I must thank the Shield Connect also for all the support and the logistics. And a very good evening to all the delegates who might be joining and who have already joined, and to you also for this very important evening of today. So I would like to share my screen. Mm. So can you see my slides?
Yes, ma'am. It is very much visible. Just go for the screen share, the bigger one.
Done. Yeah. So is it visible?
Yes, ma'am. Yes.
So today we would be discussing about the platelet-rich plasma, which has been used in many aspects like the skin, the dentistry, the plastic surgeons are using, maybe the orthopedic people are using. But in gynecology, it has a huge role which we are missing out. And it is the regenerative cellular therapy in the gynae aesthetics. We will initiate with the basics and then we will embark on the various protocols. And after the protocols, we would be discussing a few biologics which are emerging in the 2023. And I am Dr. Sangeeta Mehrotra, as has been introduced by Dr. Poonam and the Shield Connect people. I'm a senior consultant OBGYN, credentialed menopause practitioner, and a very passionate cosmetic gynecology. I love to learn everything in and out. I want to deep dive into cosmetic gynecology. So we would be discussing the platelet-rich plasma. It's not moving. So as we all know that cosmetic gynecology is an amalgamation of energy and biologics. It is a synergy between the energy-based devices and various biological biologics. So the platelet concentrate, or the PRP, is also called as the Elixer of Life. It is an effective concentration of multiple growth factors and the adhesive glycoproteins. It is derived from your own blood, that is, it is autologous, and it has all the potential to orchestrate the natural healing cascade. It is said to be a biotherapy, and it has a promising facet for the regenerative medicine. The PRP has as high as 94% of the platelets, but the normal blood has only 6% of the platelets. So platelets are rich in cytokines, chemokines, coagulation factors, immunogenic molecules, regulators of growth, and angiogenesis. These platelets, they have three types of granules: the alpha, the delta, and the gamma. The alpha granules of the platelets, they are packed with the key growth factors. And once the platelets, they are activated, these granules or they get degranulated, and the growth factors, they are released. And this causes the healing and the tissue regeneration. The activation of the platelet, it is said to be done exogenously by the calcium chloride, or even by the thrombin, or just the mechanical trauma by the needle or the syringe, or even a slight temperature change above 24 degrees centigrade can cause the degranulation of the pre-packed growth factors and release of all the growth factors. So these native growth factors, as they are called, they are released in biologically determined ratio. The various kinds are the platelet-derived growth factor, the vascular endothelial growth factor, transformation growth factor beta-1, keratinocyte epidermal growth factor, the fibroblast growth factor, and the platelet-activated angiogenic growth factor, which is one of the most important growth factors which is released. So the PRP is constituted by the platelets, the neutrophils, the lymphocytes, the monocytes, which convert into macrophages. They become motile, they migrate to the soft tissue. They cause a balance between the pro-inflammatory and the anti-inflammatory aspects of healing. The fibroblasts are there, which produces the collagen and the reticular fibers. And the vasoconstrictors and the vasodilators are also there. And very small amount of primitive stem cells are also there. So this is the constitution or the content of the PRP. Now the question arises that what is the optimal level of the platelets which is required for growth and angiogenesis, or rather the rejuvenation or the regeneration? It is said that if the PRP platelets should be at least 4 to 6 times the baseline or even greater above the baseline. The PRP has 2 million per ml microliters of the platelet, whereas the normal blood has around 2 lakhs microliters of platelets. So the PRP has 4 to 6 times or even higher amount of platelets above the baseline. So this is the optimal level of the platelets which is required. Now, what is the proposed mechanism of action? It modulates the mesenchymal stem cells, synthesizes the extracellular matrix, causes the release of growth factors, cytokines, and the chemokines, causes tissue necrosis resolution, angiogenesis and epithelialization, cell proliferation,